Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Internal Medicine, focusing on endocrine, diabetes, and metabolism. Let's get started with question number 14. For the following case, the treatment most likely improved this patient's condition by directly inhibiting which of the following processes? A. Colloid production. B. Coupling of iodotyrosines. C. Iodide uptake by the thyroid gland. D. Peripheral thyroxine to triiodothyronine conversion. E. Triiodothyronine or thyroxine effect on target tissues. The case scenario is: a 22-year-old woman comes to the office due to palpitations, weight loss, and insomnia. She has lost 7 kilograms in the past 3 months. Otherwise, the patient has no other medical problems and takes no medication. She also does not use tobacco, alcohol, or illicit drugs. On physical examination, blood pressure is 130 by 80 millimeters of mercury and pulse is 104 beats per minute and regular. The thyroid gland is diffusely enlarged and non-tender on palpation. Laboratory studies show markedly decreased serum TSH and elevated thyroxine levels. For that, methimazole monotherapy was initiated. 2 months later, her symptoms had resolved. The question is: the treatment most likely improved this patient's condition by directly inhibiting which of the following processes? Your options are: A. Colloid production. B. Coupling of iodotyrosines. C. Iodide uptake by the thyroid gland. D. Peripheral thyroxine to triiodothyronine conversion. E. Triiodothyronine or thyroxine effect on target tissues. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is B, which is coupling of iodotyrosines. This question is designed with the focus to assess your ability to apply foundational science concepts. Thyroid follicular cells take up inorganic iodide, which is called iodide trapping, against a concentration gradient using a sodium iodide symporter. Iodide is then released into the thyroid follicular lumen, where it is oxidized to iodine radical by thyroid peroxidase. Iodine then binds to tyrosine residues, by the process known as organification, in thyroglobulin to form monoiodotyrosine and diiodotyrosine. Coupling of monoiodotyrosine and diiodotyrosine produces triiodothyronine and thyroxine. The thyroid follicular cells then engulf thyroglobulin, which contains the iodinated tyrosine compounds, via pinocytosis. In the thyroid cytoplasm, T3 and T4, collectively, thyroid hormones, are removed from the rest of the thyroglobulin and secreted from the basolateral border. This patient with elevated thyroxine and suppressed TSH has primary hyperthyroidism. Methimazole and propylthiouracil are thioamide drugs used for treating hyperthyroidism. They inhibit thyroid peroxidase, the enzyme responsible for both iodine organification and coupling of iodotyrosines. Propylthiouracil also decreases the peripheral conversion of T4 to the active hormone T3, although methimazole does not have this effect. If you choose any option other than B, you are wrong. Let's briefly discuss the other options. Choice A cannot be the answer because colloid is a gelatinous material in the follicular lumen that consists mainly of thyroglobulin. The production of colloid is regulated primarily by TSH, it is not dependent on thyroid peroxidase and is not inhibited by thioamides. Choice C cannot be the answer because iodide uptake is upregulated by TSH. Perchlorate and pertechnetate are competitive inhibitors of the sodium iodide symporter. Choice D cannot be the answer because methimazole and propylthiouracil are thioamide drugs used for treating hyperthyroidism. They inhibit thyroid peroxidase, the enzyme responsible for both iodine organification and coupling of iodotyrosines. Propylthiouracil also decreases the peripheral conversion of T4 to the active hormone T3, although methimazole does not have this effect. Choice E cannot be the answer because hyperthyroidism is characterized by increased sensitivity to catecholamines due to the thyroid hormone-mediated upregulation of beta-adrenergic receptors. Beta blockers help decrease the target organ effects of thyroid hormones, and some beta blockers, like propranolol, also decrease the peripheral conversion of T4 to T3. Your take-home message from this question is that thioamides, like methimazole and propylthiouracil, decrease the formation of thyroid hormones via inhibition of thyroid peroxidase, the enzyme responsible for both iodine organification and coupling of iodotyrosines. Propylthiouracil also decreases the peripheral conversion of T4 to T3. Did you get the answer? Only click above to move on to the next question if you have the answer correct. If, however, you are unable to accurately respond, you must watch this episode once more. Recall that comprehension is essential for advancement. Discover the key to slaying your medical examinations with our excellent resources, especially the USMLE. Make sure you and your friends are ready by clicking the like button, sharing this abundance of information, and becoming a channel subscriber. Recall that all it takes to succeed is one click.